News.
With me now is Dr. Gavin Macgregor-Skinner from the Department of Public Health Sciences at Penn State Hershey. Thanks for being with us. So the UK and the US are going to be screening passengers for symptoms of Ebola. Is that enough?
It gives us another level of protection. About 150 people from Guinea, Liberia, Sierra Leone arrive in the US every day. And what we're going to do at airports now, these 5 airports are identified, we're going to take their temperature. We're going to ask them questions. Where have you travelled from? How are you feeling? Who did you have contact with? Where are you going? And then we're going to be able to give them, this is the third critical function, give them advice of what to do if they leave the airport and they develop a fever within 21 days after arriving in the US.
But do you think that's adequate? Should more information be given?
They do need some additional information. And what they need to do, they need to know is, if they have left the airport, they've arrived from West Africa, they develop a fever, what do they do next? And we really want them to stay at home. We want to go and pick them up because what's coming in winter? It's going to be flu season. And we don't want these patients with fever and body ache and fatigue going into our hospitals, sitting next to people like a woman who's pregnant or a child with a broken arm, and have a possibility of risking spreading Ebola.
Now, you were in Nigeria where the outbreak was successfully contained. You were part of that effort. How did they do it?
The Nigerian government had a plan, and it was a whole-of-community plan. They brought everyone in from the community. They didn't stigmatise the Ebola patients because of their years and years of experience with HIV/AIDS. They actually made it an incentive for people to report. They used SMS text messaging for contact tracing. They celebrated every success they had, and every person that was in the neighbourhood, from church elders to multinationals to corporate businessmen to academia, all played a part.
Now, you talked about AIDS there. The head of the CDC has said that he hasn't seen anything like Ebola since AIDS. Do you think that comparison is apt?
At the moment, we have seen a situation in West Africa, in those 3 countries, which is completely out of control. We've recently had our first patient here in the US, and look at the way we treated that patient. We stigmatised them, we treated them like criminals. That's very much what we did in the early days of HIV/AIDS.
Now, you've also been in Liberia. The US is going there to build all these treatment centres. How's that going to work, do you think?
It's very, very much needed. And whether we build enough, I'm not sure. One of the biggest challenges we're facing as we build these new Ebola hospitals and facilities, where are we going to find the staff? And it's not just the doctors and the nurses, it's all the staff that make the meals, clean up, the janitorial staff. Where are they going to come from? That's really going to be a challenge.
And how are they going to be protected, those healthcare workers? Because as we heard in that report there, they are most at risk.
Very much so. And again, there's 2 levels of protection here. When I was setting up Ebola isolation wards in Nigeria, we were attacked by the local community. And they didn't understand. But there's also then, do we have enough bleach, enough protective equipment? Do we have all the systems in place to deal with the waste management and the number of blood tests we have to take each day?
Dr. Macgregor-Skinner, thank you so much for joining us.
You're welcome.